Hi there, welcome to familydoctor.expert. Today we're going to talk about familial hypercholesterolaemia. What a mouthful. But it basically is a very high cholesterol level that runs in families. Actually pretty common, probably 1 in 400, 1 in 500 carry one of the single genes that causes this very high level of cholesterol. Now, you may not be aware, but there's actually separate sorts of cholesterol in your blood. There's good cholesterols and bad cholesterols. And one of the bad ones is called LDLs. And that's the one that's really high with this disease. The problem is that this little type of cholesterol binds to a receptor, and there's something in the genetics which means that that receptor doesn't bind up all the cholesterol. So what's the problem with that? The problem is that you end up with early onset heart problems. So the classic family and the sort of red flag for GPs will be a family who's got people having heart attacks under the age of 50, maybe even under the age of 40, if not a full heart attack, having heart disease, chest pains. So that's usually a red flag for the GP. But sometimes this test just comes up because you're having your routine blood test and the GP says, oh, your cholesterol's very high. The point for the GP is that it's the LDLs, these bad guys, which are particularly high, and often the other sorts of cholesterols we call HDLs and triglycerides are normal. So this is a little bit of a flag for the GP. The other trigger for the GP may be if you have what we call clinical signs. And classically, there's a few things people have. They can have these fatty deposits sort of on their eyelids called xanthelasma, or the GP may have a look at your iris and it's got a subtle sort of ring around it, which we call arcocinilius, which is also a sign of this familial hypercholesterolemia. Sometimes people even have these fatty buildups in their tendons, especially that tendon called the Achilles tendon down in your foot. We know that there's actually one main gene that causes it called the LDLR gene, but there's another one, ApoB, which also causes it, and some other rarer sorts. Now, it's passed on in a pattern that we call autosomal dominant. That means that if one of your parents carries the gene, there's a 50% chance that you're going to have it too. And if you have the gene, there's a 50% chance that you're going to have coronary artery disease before the age of 50. So your GP really wants to get onto this. There's lots of things you can do with dietary change. In particular, some of what we call the plant sterols and stanols, so that's things like vegetable oils, nuts, and the whole range of other things that a dietitian could help you with, is a sensible sort of diet to go on. Your GP will also be trying to head off your overall heart risk, so avoiding diabetes, avoiding obesity, not smoking, keeping your blood pressure under control, all these things. Now, we've got some good medications. The main group that we used are called the statin drugs, and your doctor will talk to you about that, but there's also some other drugs we use if we're having trouble getting your cholesterol down. Now, in very rare instances, someone can get a gene for this disease from their mum and their dad, what we call homozygous. This is very rare, like 1 in a million, but it does cause a serious disease, usually appearing in childhood, and we won't go into all the details about that today. So the message is, if in your family you've had people who've had heart attacks young, go and get checked by your GP. Your GP will probably check your cholesterol every year or two anyway on a blood test, so it may well turn up. And there's lots that we can do to treat it. Now, as usual, this video is just for general advice. Speak to your regular doctor about your particular circumstances. Anyway, I hope this is helpful, and I wish you well from familydoctor.expert.